Hi, it's Mo Bhandari, and I'm having a conversation this evening with Dr. Johnny Lau, who is an orthopedic foot and ankle surgeon at the University of Toronto. Johnny, we've known each other for many, many years, and I'm very, very curious how this last year's been for you with respect to just the current situation, COVID-19, the pandemic, and the impact on your practice and life.
I think it's changed life for everybody. You kind of think about work. You get up, you go to work. You get up, you look after your patients. Certainly, when we started, there was a lot of unknowns, and a lot of people just decided to start treating fractures and injuries non-operatively because we didn't know if it was safe to bring people in the hospital. We didn't know if we were going to get inundated with cases like Italy and China, and we didn't know all sorts of things. So I think with the first wave, there was a lot of non-operative orthopedic care for injuries that we would have normally fixed.
So everyone has always an example, right? But when you go back and someone says to me, why Exogen or why bone stimulation, you probably have that one patient that you probably say, well, I'll tell you why. Or was there that one moment or that one individual, that one particular case that you remember was the moment at which you realized I'm going to use this a lot more often? Because oftentimes, all the evidence aside, you
Yeah.
have to see it work in patients.
Yeah, I think, I've always been looking after athletes, and I also worked on WSIB injuries. I working with injured workers.
Right.
And I think one of the cases was really a worker that had an ankle fracture that was fixed. Um, it was a bimalleolar ankle fracture where the medial side was fixed, the lateral fibula was also fixed, but it was very slow to heal. And he's a 40-50 year old guy, and you always think twice about operating on somebody with WSIB because you're not sure whether they're going to recover as quickly as you would expect because of secondary gain.
Sure.
This guy was fairly legitimate, and he had a clear non-union on his CT scan.
Right.
And you could see the non-union, and it was like 6 months after the fracture. The hardware was stable. The gap was only about maybe 2 or 3 millimeters, but it was a clear non-union. But this guy said, he couldn't have surgery right away due to personal reasons. And I said, okay, let's try Exogen. We got nothing to lose. Let's see if this works. And I used it 20 minutes a day for about 2 months, and I
Yep.
saw some healing after 2 months. And he was still weight bearing, no fracture boot. He says, okay, I'm ready for surgery now. And I said, well, you know what, this thing is healing. Why don't we give it a little bit more time? You're not really hurting, and let's try progressing your duties at work. And he seemed like a fairly a genuine person.
Right.
So we used Exogen, and after another 2 months, we had close to 50% union, and I didn't have to go back and operate on him, and he went back to work. And it proved to me that there was some utility in this.
Well, that's interesting. So I am always interested in the discussion that you would be having with patients in general. So I imagine from the first time you used it to where you use it now, what's that discussion like when you're talking to patients who, for the first time, for the most part, probably haven't heard about it? I'm sure some come to you saying, tell me about bone stimulation, or they've heard about it. But those that haven't and they're contemplating surgery, what's your discussion with that patient? Is it very similar to one you just had with this patient on WSIB, or have you changed it subsequently
Yeah.
as you've been using it more?
Well, the reason why I brought WSIB is, Exogen is a device that is recognized as something that WSIB will fund, and
Right.
there was no issues getting funding for the device. I think the big improvement is really the biology, how we handle the soft tissues with minimally invasive approaches,
Yeah.
and some of the um, biologics that we use to facilitate healing, and Exogen, which, to layman, when I started, it was this magic box. But if you really think about it, it really upregulates the production of bone factors. So
Right.
it's a biological device to supplement your surgery.
And I'd
And
also, oh, sorry, go ahead. I was just going to say, I'd also imagine too, Johnny, that there'd be patients who would be looking at surgery as a pretty scary, proposition, considering they've had one, right? So they're thinking, oh my gosh, I've got to go through another procedure. It's going to be a little bit bigger. I'm going to have time off work again. I mean, it does seem to me, but I would imagine there'd be a lot of patients who'd be willing to give it a go, just generally, because if it has a chance to heal me without having a secondary surgery, it's got to be a big draw for patients.
yeah, when I think working at a tertiary quaternary care hospital, I deal with a lot of revision cases.
Right.
It's not just a fairly straightforward subtalar fusion. Somebody that's had one or two operations that hasn't worked out, and the guy, he or she's been on crutches for a year, and they're frustrated. Um, and to give them every opportunity to heal as quickly as possible. It's providing the best surgical care, but also addressing some of the biology. And certainly you can do that with bone graft substitutes, but something like Exogen is I think a reasonable option to help with the biology, which everybody needs when you're dealing with revision cases.
Absolutely. And you've been using it also, it sounds like, for some of your non-trauma cases. So when you're doing a fusion, are you also using Exogen or some similar device?
Yeah, no. Anybody who's high risk,
Yeah,
like a diabetic person,
right,
revision surgery, high BMI,
right.
we have a discussion, and a lot of time it's fairly positive because people want to get back to function, and certainly with COVID, we're not doing much now, but you know everybody thinks and everybody believes, and I believe that there will be an end to the pandemic. They
Sure.
want to be there for that end. They don't want to be on crutches when
Yeah.
everybody's enjoying themselves. So ideally they want to get back quickly.
And how about those surgeons when you're at rounds, you present the patient, you mention Exogen, there's always someone in the audience that says, why'd you use Exogen? How do you help surgeons or peers who don't use Exogen understand the value of Exogen in your practice?
As an orthopedic surgeon, there's fractures you should fix and fractures you can kind of watch. And somebody with broken metal with a gap more than a centimeter and an obvious deformity, you're not going to put an Exogen on. You're going to fix it and you're going to make it straight and you're going to put the ends together. Um, Exogen is a device that still it complements our orthopedic principles. And I remember quite vividly giving a talk to a group of orthopedic surgeons, trainees about Exogen, my experience, and being questioned by one of the senior guys about Exogen. And, I've explained my experience. And again, it's not 100%. I think it's 80%, which I think is a fairly good odds. So 80% somebody that potentially could save them from another operation, people would take those odds. Or 80% to improve healing of a subtalar fusion. When it was 60 or 70%, people will take those odds. And at the end of the night, the orthopedic surgeon admitted that, yeah, he's very skeptical, but he did have some personal experience because his son had a tibia fracture that wasn't healing. They used Exogen and it healed. So
There you go.
everybody will have a story. Certainly, I think it has to be used appropriately, like any orthopedic device we have. It's not a magic box. People have to know the indications. And if it's applied appropriately, you're going to have more winners than losers.
I think that's a really, really a great way to sum it up, and also a way to sum up our discussion this evening, Johnny. Thank you so much for taking some time to chat about COVID and also just patient management during this very difficult time. Thanks so much.